Hello everyone, this is Dr. Sangeeta Chaudhary. I'm a consultant physician and today I'm making this video so that I can share my own experience of long COVID with you. Now, what is long COVID? Most of the time we see that COVID patients, they usually recover within 1 to 2 weeks, except those who suffer from severe COVID-19. They usually take a longer time to recover. They may take even up to 4 or 5 weeks to full recovery. But it has been seen that many patients continue to suffer from the symptoms even after months of contracting COVID-19, and this situation is known as long COVID or post-acute COVID. The exact etiology behind the post-COVID, acute COVID or long COVID has not yet been identified, but it has been suggested that it may be due to the disturbed immune response of the patient. It may be due to relapse or reinfection by the virus, or it may be a part of the post-traumatic stress. Now, who are the people who develop long COVID? Data suggests that females, elderly population, people with high body mass index, and even the healthcare workers are at increased risk of developing long COVID. The common symptoms of long COVID are cough, shortness of breath, fatigue and chest pain. Other than these common symptoms, a patient may continue to experience loss of smell and taste sensation, dizziness, headache, body ache, joint pain, palpitations, and sometimes the symptoms may appear after physical exertion. The diagnosis of long COVID is clinical. A proper history can help us to diagnose a case of long COVID. And the management of long COVID should be individualized because the symptoms will vary from person to person, and the management of long COVID is basically symptomatic and supportive, and we should have an individualized rehabilitation plan. Okay, so this is about long COVID. And one more thing, if we talk about the prevalence of long COVID, that means how many percentage of COVID-19 patients will continue to have long COVID. It is seen that out of 10 COVID-19 patients, one patient, out of 10 COVID-19 patients, up to 3 patients can develop long COVID. Okay. Now, if I talk about my experience, I was diagnosed with COVID-19 in the last week of February 2021, and even after almost 9 weeks of contracting the disease, till now I have certain symptoms like cough, I have occasional shortness of breath, I have fatigue, and I am doing lots of breathing exercise. I am trying to maintain a healthy diet and quality sleep, and I am taking help of supportive medications to overcome my symptoms, and I am recovering. Okay. Thank you so much for your patient sharing, and I hope it helps.